So last summer, I threw out my back playing softball. I was confined to my bed for several days, unable to move for fear of every little painful twinge. After a while, staring at my ceiling for hours on end got a little demoralizing. Would I ever get another chance to swing for the fences? Well, after a bit of time and conservative management, my back worked itself out just fine and I was back on the field. But not everyone is so lucky, and as I learned during my week of bed rest, chronic pain can have some unexpected emotional baggage.
Chronic pain and depression are closely linked. People who have pain for 3 months, 6 months or more, they've been to lots of medical doctors, they've had procedures done, they've had surgeries done, they may be on lots of medications. They're frustrated. They still have their pain, so they get depressed. And sometimes the depression might just be a minor depressive mood state and they're able to function. But sometimes we see full-blown clinical depression where people stop functioning. Many times it's not the physical pain that prevents them from functioning, but it's the emotional pain, it's the depression that really prevents them from functioning. They get so depressed because they have the pain for so long and no one has really been able to help them. So it's like a vicious cycle. Chronic pain causes depression and depression causes chronic pain, and the two kind of feed on each other and make each other worse.
When depression and chronic pain become so severe that the patient loses the hope that they will function normally again, they need to see a pain specialist, particularly one who practices with a team of other doctors like neurologists, psychologists, and physical therapists. With that team by their side, the patient can work at overcoming both their chronic condition and their emotional state.
We all get together as a team and decide on the best approach to treating the patient's pain. And usually it's a combined approach so that we all see the patient separately but together. And we meet as a team from time to discuss the patient's progress. Usually there is a direct correlation. When chronic pain does improve, then depression improves. Or sometimes we make more of an impact on the depression and then the pain actually improves. Sometimes what happens is we really help the patient with their depression, and while their pain level might stay the same, it doesn't bother them as much.
Recent studies show that motivation is a large component to the healing process, but finding motivation is sometimes a challenge for these patients. They have to find something to help them overcome the obstacle of physical pain and demoralizing depression, whether it's a desire to go back to work or play freely with their children or even just have a positive change in their life.
You need to educate them about what's going on and how important it is to have a better level of functioning. Many patients are stuck on the fact of, well, I have my pain. I can't do anything as a result of my pain. And when my pain goes away, that's when I'll start functioning. So they need to be educated that that's not really true, that they need to function even with pain. One powerful intervention that we do have with patients who may not be that motivated to change is to put them in a group. We have groups of people who have pain, and they begin to talk to each other, and they begin to challenge each other in terms of, well, you know, I have pain also. I'm able to do this. I'm able to cook supper. I'm able to take care of the kids. Why aren't you able to? Why are you in bed all day? Why are you on the couch? And many times when they see how other pain patients are coping, it kind of makes a big impact on them.
Another important component is the significant other, which can be a difficult role to play. They need to be sympathetic and supportive, but not too sympathetic. You have to find the right balance of encouragement without guilt trips or being pushy. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.